up! Woo!
This is the Cardinal Cowboy Show.
Giddy up! Woo!
Well, Doctor, we are in the studio here. We're going live on the Cardinal Cowboy Show. In the studio today, again, a wonderful guest. We're excited to have in the house, Dr. Eric Nepute. How you doing, Doctor?
Good, Cowboy. Thanks for having me, man. I appreciate you.
Yeah, well, thank you, man. I appreciate you. And it seems like there's just so much that needs to be said out there that a lot of people, that's getting harder to do. I made a list.
It is getting harder to do. It's not harder to say it. It's harder to get heard than it's ever been. That's for sure.
Well, I made a list of topics for us to talk about today. And
Okay.
wanted to bounce those off. Yeah, I gave you the checklist a little bit before.
Yeah.
Say some of these are pretty hot topics. Number of things that are going on. I mean, the title of this show is talking about the election,
Okay.
and where we're very close now. It's going to be 2 weeks from today.
Yeah.
Since I know it's on a Tuesday.
2 weeks from today.
And so November 3rd. So that is where we're at with 2 weeks left. And boy, I mean, if I'll jump right into the first one I talked to you about. Boy, I mean, very, very scary for our country. The President of the United States contracted COVID, and that can be really scary when you're considering this is the President of the United States, and for him especially, the fact that they're 2 weeks at that time, 3 weeks, 3.5, 4 weeks
Right.
before the election. Most people are knocked out for a couple weeks with that. In the middle of this, how did that happen? I don't know. We'll get into that discussion, but boy, he bounced back fast.
You know,
Do you have any idea how that happened so readily? I mean, that was.
I mean, of course I do. First of all, you think about this. You got a 74-year-old man who's super stressed out, who is overweight. I mean, all these things that are comorbidities are risk factors, if you will. I mean, he's a healthy guy other than that, though. But he bounced back, what, was he 3 days? He was having an issue with it. And I know exactly what he was doing. I mean, you have to understand, obviously, you know that we do a lot of work with politicians all over the country, and I'm in D.C. quite a bit doing work, and local here doing work, and et cetera. And President Trump has been using the very similar protocols that we've been recommended from the beginning of this thing, with high-dose zinc, high-dose D3, with amino acid use, with vitamin C. Obviously, he did some, pharmaceutical treatments as well, at least what they reported to us that he did. And, he's in the hospital. 3 days later, he's back home, and he's back to work. And he was working while he was in the hospital. He had a day that he was under the weather, which, I think people forget that it is flu and cold season, and we forget that there's normal sick that still happens, normal cold, normal flus, normal symptoms, and he bounced back quicker than ever. So, I think it just proves that if a 74-year-old man that's in that category that, once you get COVID, it could, the word on the street is it's going to kill you, which, that's not the case. If you look at the numbers and stats, it doesn't support that at all, even though the mainstream wants you to believe that, to fear you and propagate an agenda. The reality is that he really bounced back quick because he was doing the right things. So we know that he was doing high-dose zinc. We know that he's doing high-dose vitamin D3. We know that he's doing high-dose C. We know that he's doing IV vitamins as well. So those are the reasons, Cowboy, why he did so well.
Well,
and continues to do well.
And it was rather impressive. It was, I would say, almost amazing because, I mean, he's a go-getter. He wants to keep it going. It's hard to imagine he's actually, 74 years old and of that age, or people are normally settling down, starting to retire. But, I guess that's part of what got the president to where he's at. Where do you go with this COVID stuff? I mean, long list on the list of topics to talk about, but how is it impacting currently the election and what in the discussion there? And you start to listen, are they still getting terribly excited or fearful on both sides? I had somebody who's a counterpart of mine I've worked with for a long time, and she put out posts that say 200,000 deaths. How can there not be any outrage and horror about this? And I start to analyze it, and I go, well, you're lucky that's all there is, based on the fact that they're going to cause more deaths from malnutrition, untreated health sicknesses, alcohol abuse, and drug overdoses, along with, what was the primary one? Oh, suicides are out now. So we get into a whole discussion. is this going to affect our election from the perspective of keeping people home?
I think so. I think absolutely it does. And again, we're just having a conversation, and some of these things that we're going to say today, first of all of them backed up with factual data. At least I know everything I'm about to say, and then some is all about factual data. Everything I've said from the beginning has always been about factual data. And there hasn't been one thing that we've talked about since early spring of this year that hasn't come to pass and been true. And one of the things that we talked about was how in October and November around the election is there's going to be some things that are going to be in the news, in the media, are going to scare some folks. And I just today, I pulled up some numbers as of today. Carter, I just wanted to read this to everybody that I put on my phone. I just want to give some quick numbers for everybody. You be the judge of what you think about these numbers, but some quick numbers for everybody. So the United States population is around 330 million people. Total COVID cases is around 8.2 million cases in the U.S. Total COVID deaths is around 220,000, like you said. That means that nationwide you have a 0.025% chance of catching COVID. And you actually have a 0.0007% chance of dying from COVID. But wait a minute, there's more. We're in the state of Missouri, okay? So I want to show you some of Missouri's numbers, all right? So Missouri total population, 6.15 million people. Missouri COVID cases, 164,000 cases. Missouri COVID deaths is 2,660 cases, which means your chance of catching COVID in Missouri is 0.027%, and your chance of dying of COVID in Missouri is 0.0004%. But hold on, Cowboy, there's even more. St. Louis population is 2.2 million. The St. Louis COVID case in St. Louis is 28,239 as of this morning. The St. Louis COVID deaths is 857 deaths, which means your chances of catching COVID in St. Louis is 0.019%, and your chance of dying of COVID in St. Louis is 0.0004%. But yet, we're still so propagating this fear that, by the way, remember, the flu kills 0.13% of the American population every year. So if you look at the 0.13. Right. Okay, not 0.0004 that we're talking about. Okay, so I get it, and some people are going to comment and say, "Well, my grandma died of this," or people have died from this. COVID-19, SARS-CoV-2 is a real thing. It is a real virus, but it really only affects a certain part of the population. And you know what? If people are scared to go out and vote, they need to look at what's happening really all over the country and all over the world. And the reality is there has not been one reported outbreak of any voting that's happened at all in the United States or anywhere else in the world for that matter since COVID has happened. And we've had lots of elections. We haven't had a presidential election, but we've had lots of elections. And another thing that was brought up at a meeting that I was at this morning that I thought was pretty interesting, just some common sense, because you guys know, that's what we do on social media. We're all about common sense health. And you think about this, Cowboy, Walmart has 1.5 million employees. Amazon has 750,000 employees. Kroger has 500,000 employees. Target, 350,000 employees. Costco has 250,000 employees. That's a total of 3,354,000 total employees still working in the United States. These employees come in contact with thousands of people a day, yet none of these companies are reporting an excess amount of COVID-19 cases, yet small businesses aren't allowed to operate. So there's a double-headed sword with all the stuff that we're talking about. And people are legitimately scared to go out, but based off of numbers that don't, in my opinion, legitimize their fear. So that's kind of where we're at right now. And I do believe that, we talked about how COVID is a real thing. There's no doubt about that. But it's been over-politicized. And many, many doctors will tell you that. Even the reports from the CDC out of the 220,000 people that have died in the United States of COVID, 94% of those folks had something else going on with them. They had 2 to 3 comorbidities.
Comorbidities, yeah. And this was it 2.3?
2.3.
Not just one other major health issue, 2.3.
And those comorbidities, by the way, people don't realize this. Those comorbidities, the main ones were high blood pressure, diabetes, cardiovascular problems, and respiratory issues. Like, those are the comorbidities that led to it. But what people don't realize is that, like, for example, if you have those top 4 comorbidities, and I just did a whole workshop on this just the other night. It's on our Facebook feed, if it's still up, that is. And I showed how those comorbidities actually lead to reduction in zinc absorption, reduction in vitamin D3 absorption, which happen to be 2 of the huge forces that are out there that are showing for folks to have high risk factors. And in fact, if you go to our website, which is ericnepute.com, I would encourage you to go there now. It's ericnepute.com. And there's a Cowboy, there's a sheet there that people can download for free. And it's a sheet that shows people what they can do to help mitigate the risk of getting virus infections, whether it's colds or flus or et cetera. And then it talks about what you can do to prevent, and then it talks about what you can do for 7 days to reverse the symptoms. And we've had over 120,000 people across the United States right now utilize this protocol. And my gosh, we're getting literally hundreds, if not thousands, of reports a week from people that are just doing amazing by following those protocols, which is very similar to the protocol that President Trump was following, by the way.
Yeah, it almost seemed when I heard him list the detail for everything that was included, I'm like, did Dr. Nepute send that to the president? Because it's exactly what you had been prescribing to people, outside of a couple of prescription drugs.
Right.
And I remember those names of those now, but I mean, literally, it was line by line. Personal note from what had happened, and sadly, somebody close to in my family had been suffering from another comorbidity.
Yeah.
And had a quote unquote DNR.
Yeah.
And it was really just a matter of, they could have resuscitated, but he had requested that not be the case. And, getting that he was in bad shape from another comorbidity and actually a couple other things. And so that's what weighs on you. But, could they have fought through this? What was the real issue? Part of the problem was the treatment that was allowed or not allowed, or the visitation that wasn't allowed. That, it's nice that the nurses, they do a good job, but they don't always have the time to pay close attention like somebody who's a family member who really cares and is going to sit there and observe closely. And I would argue that had something to do with what was going on. So how many deaths were there that should not have happened, that they really could have eliminated because of the proper treatment? I get, given that it was true that this kind of came up and we had to kind of lock down, or at least figure out what was going on. But man, look at some of the other countries and some of the much worse situations, and others that didn't lock down and their situations were better. Can you talk about the stats with regard to the way we've handled this and where we're going to go with this?
Well, for sure. I mean, first of all, we collectively knew more about this than we let on to believe, just so everybody's clear of that. Like, for example, I don't know if you know this, there was a study that was done in 1989. It was from 1989 to 2001. It was a study done in Massachusetts. And what the study did was it measured the health factors in individuals that lived in nursing homes in Massachusetts. They followed these large nursing home facilities, thousands and thousands of people they studied over this 4-year period. And they measured their nutritional levels and their risk for sicknesses and diseases. And one of the main things that they found was that individuals who had zinc levels that were lower than the normal amounts, below a 70 on a blood test, what they found was those folks that had those lower levels, once they brought those levels, Cowboy, up to normal or above normal, this is a very important stat to hear. They actually had a 40% chance less of dying of all causes, and a 50% chance less of dying of any type of respiratory condition, even pneumonia. So if there's 40% less reduction of deaths there, and the studies that came out of Ireland, Iceland, Spain, Japan, and the United States now, all about vitamin D3. When vitamin D3 levels are lower, folks, they have a 30 to 40% chance of getting higher infection rates, higher risk for fatality, severity, etc. Let's just say that's 80% right there. Let's just say that it was 40% or 50%. Out of the 70,000 to 80,000 individuals that died in nursing homes, what if we could have got their zinc levels and D levels up to where they should have been? We could have saved literally tens of thousands of lives just from that alone right there. That's not being talked about. Why is that not being talked about?
Well, that goes into another topic on the list here. The stat I heard was 42% of the deaths were caused from nursing home people. I have an aunt that actually was in a nursing home. The other situation I was talking about, they were in a care facility and gone out of a nursing home into a higher level care and had some, but only because the issue got worse and they weren't paying as close attention as they might have been if they would have been able to visit. But my aunt literally hey, go back in there, and everybody go back to you're allowed to go back. You can't keep somebody from going back to your nursing home if that's where you reside, even though you've been diagnosed with COVID. I mean, what a horrible decision that caused so many more thousands of deaths. 42% of, I don't know what that is out of 220,000, but that's close to half. You're talking 100,000 people that died.
Yeah.
80 or so. I mean, that's crazy. Is this what was the method here? Was that just stupidity, or is there something else going on?
That's a great question because again, now you've got the governor of New York this week that came out and said, well, listen, at no time were the hospitals overrun in New York, and that was their message behind the madness with that was we want people to go back into the nursing homes and assisted and skilled care facilities to take care of these individuals because they were worried about the hospitals being overrun, which never happened. They never overran the hospitals. They never had ventilators that were overrun. That's a fact. That's never happened. And anybody that says different that's just not true. That's just not true. The governor even said that of New York. So, Carter, I look at it like this. Why is it so hard for people to realize that, our body needs certain nutrients, vitamins, supplements, and things to prosper. And vitamin D happens to be one of them. In fact, if you look at the study that was done on Ireland, and I think we talked about this before, that they found that the Irish population, when they studied this, and by the way, this study's been done in the United States and in Japan and in Iceland as well and reproduced 100%, that the lower the vitamin D levels are in an individual, the higher risk they have for infection, the higher risk they have for severity, which increases viral load, and the higher risk they have for mortality. And if you think about this, where do we get our vitamin D? It's the sunshine vitamin, right? Right. Well, what was the number one thing they told us to do during lockdown? Stay home, stay inside. Don't go outside. Be scared of the virus outside. And so that's going to increase the risk of us having low vitamin D3. And by the way, one of the problems that we have in the United States, obviously obesity is a major problem. And we're a major problem with our world, which is obesity is the main contributor to heart disease, cancer, diabetes, stroke, Parkinson's, dementia, Alzheimer's, etc., all these comorbidities. And when you're obese, you don't absorb vitamin D3 like you're supposed to. So your levels are already low from that. And so we've got those low levels of D, those low levels of zinc, which I'm telling you, this is not rocket science. It's called Physiology 101. And all the research shows that people need more of those, and that's why they're getting sick. And people are saying, well, how could you just so candidly say that? That's because that's what all the research shows. That's what all the data shows. I've been talking about that since April for everybody, and that's because we've known about these treatments in we talk about medicine. Medicine is a branch of healthcare. Medicine is not healthcare. It is a branch of healthcare, right? It's a branch of the healing arts. Well, we've known about in homeopathy and nutrition for over 150 years the protocol to keep viral symptoms down with zinc, with quercetin, with quinine, with high-dose C. We've known about this for a long time, but yet medicine's not trained on that, so it wasn't even in their vocabulary. Like when we brought that up to people, they were like, there's no way this could be true. And now every single study shows. There was just a huge study I talked about last night that was just released October 1st that talks about low levels of vitamin C causing increased viral load and increased risk for cytokine storms and death from COVID-19. And they found 94.6% of individuals that had severe COVID-19 infection and mortality, 94.6% of those had low vitamin C levels, but yet nobody's talking about that. And when I talked about it, Carter, when I talked about this stuff, when I talked about zinc, when I talked about D3, when I talked about vitamin C and vitamin C infusions, I had the FTC come after me. I had the board come after me. I had all these organizations come after me because they didn't know. They thought that I wasn't telling the truth because they themselves didn't know the truth. So it literally took 24 hours, and within 24 hours, we showed the Board of Health and Healing Arts, we showed the FTC, we showed the Attorney General. Here's the research that shows what's going on. And they're like, oh, wow, we didn't know that those were things that could actually help with this stuff. So they retracted their accusations, if you will, against us, and we've been completely, exonerated from all that stuff. But yet, we're still not talking about that in the mainstream, right? And there's still no known cure for COVID-19.
Well, America is the land of the free, home of the brave, and the First Amendment protects the right to freedom of speech, right? And that's another top topic. I do want to give you the opportunity to, if you wanted to share the stream, you're welcome to pull up your phone and share it to your page if you want to. It's on the Cardinal Cowboy.
Yeah, we'll do that.
And with that, and I want to go over a couple of the topics here that I'm going to give everybody that we're going to talk about a little bit here, just because we have such a long list of really interesting things, and the doctor is so well informed and really understands what's at stake. And we talked a little bit about this, but the doctor here has really done an incredible job of not just being a health and wellness coach and doctor and somebody that helps people get healthy. and stay well, but really an advocate for helping us to understand the right information and having access to it. And that's where I really give him a shout out to say, man, there's so much out there that most people just are ignorant to with regard to the information that's going to save their life or change their life. You made a comment earlier that I used one of my favorite quotes from Dinesh D'Souza, and he says, and he's an immigrant from India. A lot of people do realize.
Sure.
And he said, I want to go live in the country where the poor people are fat, are overweight, because things have got to be really good to where you can supply food for everyone. There's no lack of food. It's just a matter of then what kind of food are they getting. But at least in America, in this country, that problem is solved. Now, there is the nutritional stuff that goes along with that. And a lot of people talk about, well, you're eating too many carbs, you're eating not the right set of vitamins that you need, and the relative things there. But that piece has been fixed. So, or addressed, I shouldn't say fixed, but addressed. Now we need to improve that. So that's where you really come in with, hey, here's these fixes, here's these things that they're not in our daily diet that are absolutely necessary, because if we don't have these, vitamin D, vitamin C, zinc, and quinine, is how do you say that right?
Quinine, yeah.
I keep reading it in the articles, and it helps your body to absorb all those things. I mean, that's just because we've advanced in a country where we have such an incentive-based program, right? This is what we call capitalism. And in America, they've tested this thing out. We've talked about this a little bit on the show before, and that is Adam Smith came up with this theory, the wealth of nations, where he said, hey, give the people, instead of suppressing them, keeping them stuck and just essentially peasants, give them the opportunity to create things and sell things for themselves to benefit, and everyone ends up benefiting from that. But we're being locked down, and that's what I think is most at stake with regard to where we're at in this election.
Well, we're being locked down and we're being suppressed. I mean, how can you possibly make an informed decision on anything, whether it's healthcare, whether it's who to vote for, whether it's where to work, if you can't get both sides of the story? Here's a great example, by the way. So I'm literally right now on my own Facebook page, going to your page right now. Show me on here where it says where it shows I can share this. My page will not allow me to share videos right now. My social media, no, it won't do it. So I've got my marketing guys on it. Normally there's a little thing that comes up, shows share, comment, whatever. It won't let me do it because we've got so much restriction on our social media, so much restriction in the world. You look at right now, Dr. Scott Atlas, which, by the way, we'll get this video and we'll post it later on. We'll share all this stuff. But Dr. Scott Atlas, who's a great doctor, good colleague, good friend. He's now the head of the Corona task force or the COVID task force for the president. And, he gets censored on Twitter. And you got the president who puts stuff out that gets censored on Twitter. These are the people that help make policy decisions, and yet social media shuts them down. I mean, it's absolutely unbelievable. It's just crazy the amount of suppression. I mean, Carter, we've been able to reach over 100 million people with all the information that we've given out over the last 7 months. 100 million plus people. And that's because the people want the information. Don't you think that the American public is bright enough to make up their own decisions? Well, apparently social media doesn't think that you deserve that you're not smart enough to make up your own mind. So they're just going to go ahead and run ads one way from one political side versus the other. They're going to tell you the only way to beat this thing. Like you've got the CDC, Dr. Redfield, comes out and holds up the other day, last month in September, he holds up this mask and says, this mask is going to protect me more than even a vaccine. And then just on Monday on Tucker Carlson on Fox News, the CDC spokesman comes on there and says, at no time has the CDC said that a mask is going to protect me. I'm wearing a mask to protect you, which is not what they originally said. What they originally said was a mask does nothing for anybody. And by the way, people forget that, listen, I'm a physician. I've been professionally trained on how to do, when we're in operating rooms and sutures and stitches and all that. When you wear a mask, a mask is made to be worn for a certain amount of time in a certain environment, in a sterile environment. And by the way, I don't know if you know this, Cowboy, but if you're in an operating room, and I've been in many of them, and you sneeze or cough, you're taught not to turn your head. You're taught to look straight ahead and to cough this way. Do you know why that is? Because if you go this way, there's holes in the side, and you can actually you can actually get the germs to come out of your mouth into the field.
Yeah, because essentially a mask is supposed to be sealed to your face, and there's nobody who has a homemade mask that has anything. I watched a video somebody sent to me the other day about the N95. And
Yeah.
the 95, I find out, actually is designated as 95 because that's the percentage of the molecules that it will guarantee to block if used properly. The real benefit that I really studied this video made it pretty clear is the fact that even a mask that does have a smaller mesh to diminish the amount of, it's because the N95 is designed specifically with electrical pulses to attract. So when it's like a magnetic fiber, when you take the balloon and you rub it against your hair, and
Yeah.
is that how those are designed?
Yeah.
And essentially those are allowing so it attracts particles that come through that. I am yet to find anybody out of their house who's made a mask that has electrical charge built into it to catch these particles. And that's where you say you really get into the difference between these masks we're putting on our faces versus the masks that people are wearing.
Yeah.
And there's nothing they do to protect you from.
Well, let me
try to make you feel better.
Let me say this, and with all due respect for anyone that's watching right now or that watches this later, if you want to wear a mask, go ahead. I mean, if that's your decision, that should be your right. If you want to do that, just like if you want to get a vaccine, that's your right. You should be able to do that. But here are a couple things that I just want to bring up, just to think about, food for thought. And again, prove me wrong. Here's one right here. Cases exploded of COVID-19, even with mandates of masks in Los Angeles County, Miami-Dade County, in Hawaii, in Alabama, the Philippines, Japan, the UK, Spain, France, and Israel. So think about that, number one. Number two, Dr. Carl Hinahan, who's with Oxford, who's the director of the Centers of Evidence-Based Medicine and the editor-in-chief of the British Medical Journal of Evidence-Based Medicine, quotes, and I quote, "It would appear that despite 2 decades of pandemic preparedness, there is considerable uncertainty as to the value of wearing a mask." He says there's no point in it. Number three, the World Health Organization, and I quote, "The widespread use of the mask by healthy people in the community setting is not yet supported by high quality or direct scientific evidence, and there are potential benefits and harms to be considered." And the last thing I'll say is even the CDC said this, and I quote, "Our systematic review found no significant evidence of face masks on transmission of laboratory confirmed influenza," and etc. And there's just article after article after article that supports this stuff. But the problem is that most people just, how do I say this politely, Cowboy? People want to believe what they want to believe. And the reality is this: the truth will set you free if you let it. But most people won't let it. And it's just sad. What we really truly need is we need more people less sick. And we need more people to get informed. So I would encourage all of you that are watching this right now, share this on your social media feed. Tag a friend. Share it with somebody that needs to hear this message, and also go later on and do a watch party, because that's really important. And we really just don't understand what health really is, and that's part of the issue. If we really understood what health is, then we'd have a better understanding of how to get sick people well. You see, we spend over $3 trillion a year normally on healthcare, and I would be okay with those expenses, and so would you. If we got the results that we wanted. We spend more than the top 100 industrialized countries combined, but yet we still rank in the lower half when it comes to infant mortality, longevity, quality of life. So we're spending all this money, literally wasting this money. When I've spoken with the CDC twice. I've met with the powers that be that are working on healthcare reform. And when we showed them the difference between what we call wellness care, which is preventative care, and what you would consider more natural care versus, what we're doing in medicine, from a business standpoint, I don't know if you know this, but every $1 that you invest into your true health care or into wellness care, you can actually get a $3 return. So every $1, I'm going to get $3 back. That's a great investment. Whereas the medical system we've got with Medicare, Medicaid, and all that, every $1 we invest, it costs us about $3.50 to invest that. That's not a good return on your investment. So when we showed that to the administration, they were like, really? Why has no one talked to us about this? Why is this not there? Because, the number one reason why people go bankrupt is because of healthcare costs. And 50% of those people that go bankrupt that have quote unquote Cadillac health insurance, But it's because the system is really, truly rigged against us. Now, I'm not against medicine. I have medicine in my offices. I think medicine's great, but I'm against people not getting both sides of the story, knowing that there are things they can do to reverse their diabetes. There are things they can do to lose weight. There are things they can do to improve their immune system. The problem is just most people aren't educated, inspired, and informed on those things.
Well, you've covered some important stuff. I did grab one of my masks.
Okay.
And I wanted to show people a little bit about, my theory a little bit. Tell me, and I try to be very logical and practical.
Yeah, sure.
And so, and as a matter of using a mask and what's effective, let's just, because we talked about it just a minute ago, and I go into this, but when you're looking at what a mask does and how it affects and does protect you, here's what we've got, right? And so this goes up, and this is probably the most popular mask in the world. Everybody's seen these, and they see where these were made on the floor in some little hut in the Philippines or something.
Right.
There's videos to show that. I'm not making that up. But if you look at it, so we talked about the leakage, I think is the terminology that you use, because an N95 is actually seals to your face, where here, I can feel air holes, gaps here, feel air gaps here.
Yep.
One major issue there, obviously, with regard to the use of the mask is that. Then the fact is, these are very rarely going to be washed. I don't know.
No, of course not.
Anybody that's ever actually washed the mask. I'm from Fenton originally, so we say washed.
Yeah, sure, I got it.
Puts a little emphasis. You're going to war and you're going to get it clean, so we say washed. But literally, so here's my big argument: is that every time I've studied this, 16 to 23 times the average human touches their face. So let's just say that the mask does do a little bit to block some of it, but you're counteracting that because as soon as you touch like this, and the president finally mentioned it the other day, I heard him in a discussion, he said, they brought my food and this waiter was coming in to give me the food for my meal that day or whatever at this event, and he had been touching his face and touching his hands, and then he handed me my food, and I'm like, exactly, that is like the last thing you should ever have with somebody. So then you're supposed to wear gloves all the time too, and by the time you've done this, I have yet to see anybody who actually, when they were about to sneeze, go up to somebody and go, achoo, right into their face, right? That's what this thing is designed for, because we already know it doesn't keep air from traveling around, so the breath is going to go anywhere all around it. So it's blocking the particles, right? Well, the particles only going to, I count on my hand how many times I've had somebody spit into my eye or into my face or mouth when I was talking to them. But it's 10 times more likely they're going to touch their face. And this happened to me. This is where I lost it for the third or fourth time. And I just go, all right, guys, I'm at a store that happens to do cell phones. And we're doing an update and getting some stuff done. And well, I actually walked in and I go, I got to have my mask, don't I? So I said, here's my phone number, get started. I went back out, got my mask, came back in. And then we got started. And I said, we all have to wear masks in here, I guess, because we're all protecting each other. Yes, of course. And then we got started. She goes, can I see your phone? And I go, are you kidding me? There's more flora, bacteria, and
there's fecal matter on this, man. I mean, there's all kinds of stuff on those things.
The phone, I just cringed. That was the third time where I was in a facility where they were requiring me to wear a mask. But as soon as I handed my phone, one was at a superstore, a competitor, the big guys, and I walk in and then they go, oh, here, let me look at your coupon. And they literally took the phone out of my hand, and now everything that they've ever touched and transferred all day long since they last washed their hands just got sent to my phone, and now and they picked up what I had on my phone and it's going in their hand. I mean, this is the real way to transfer germs, and thank goodness now they're really helping to spread the bacteria in the flora to get this herd immunity kicked in. Is that what's going on?
It's funny. I keep looking at my phone, by the way, because I keep trying to see if Facebook or anybody's going to let me share this, and they won't. I'm literally banned from sharing stuff. But so what I love, I was in California not too long ago, and I went to a coffee shop up there to get a coffee, and you walk in, and it's almost like they want you in full hazmat gear when you go in there. And I'm just, because I'm an educated individual and I can have a conversation about this, to me, and most of us have common sense, so we go, this is so silly. But the lady says, all right, what do you like to order? So I ordered my drink. And then it's time to pay. They do not take cash because money is dirty, apparently. And I said, okay. She goes, we'll take your credit card. And I said, okay. And she puts this little box down. And I go, okay. So I grabbed my credit card. She goes, put it in the box. So I threw it in the box. I was like, oh, threw it in the box. She grabbed the box, took it over to the register, grabbed the credit card out with her bare hand, swiped the thing, did it like 2 or 3 times because the chip wasn't reading, did this, hit the thing, threw it back in there, brought the little box to me and brought it to me. That is that company's policy to make it look like they're doing something to make you feel protected. And what's crazy is people don't realize is that the human human experience and the human brain is all about adaptivity. We always adapt to things. And so we're literally adapting right now to this is normal. This is not normal. There's nothing about any of this that's normal, that makes sense. You know, you think about this, you got all these schools, Cowboy, I don't know if anybody knows this, but you got all these schools that are, you know, they're mandating mask wearing in the classrooms. With still to date, there has not been one school that's shown an outbreak of COVID-19 transmission from student to student or student to child, or to student to teacher that caused these problems, which all these teachers were up in arms about. If you remember last month or a month before school started, all the teachers unions were saying that you're going to kill the teachers by doing this. There has not been one case, nor is this been politicized. In Michigan, there's a whole school system that got shut down because of a measles outbreak, and there's a flu outbreak. And shouldn't the mask stop them from having that? I mean, isn't that a viral spread? They're wearing a mask, but yet that virus spreads, but COVID doesn't, wearing a mask. So it's just so crazy. And when you look at the statistics of the children across the world, their fatality rate, I mean, survivability rate between 0 and 19 is 0.00. It's 99.9997% survivability rate. Like, what are we doing? Like, where's the common sense? And I understand. I have a lot of friends of mine that are superintendents, and I've spoken to almost every superintendent in the greater St. Louis area and around it, and they said, you know, Doc, I love what you're saying. It makes sense. The problem is we're scared to be sued. They're scared to be sued. We live in such a litigious society, and really all we need is some legislators to come out and put some legislation out. And some have brought them up. There's some in Florida that have brought up some legislation that has said, listen, you cannot sue a school district for giving somebody the flu, a cold, coronavirus, etc. Same thing with businesses, hospitals, because these businesses are already open. I mean, I thought I saw a stat the other day. Was there like 9 million people, or maybe even more, businesses that have gone bankrupt this year in the United States during COVID because of all this going on? You think about it. Target's open, no problem. Walmart's open, no problem. All these other big box stores that are seeing, you know, hundreds of thousands of people a month go through there where there's no outbreaks traced back to their facilities, right? Which is really weird. But yet there's bars that are showing outbreaks, which there really aren't. They're not showing data that supports what they're trying to do. And that's the same thing that's happened here in St. Louis County. You know, we've asked our county executive, Sam Page, to show us the reports and data that shows that, hey, you know, Little League Baseball is a hot button, and that's a hotbed for spreading the virus. He can't show us that data because it doesn't exist, even though he claims that. We said the same thing about businesses. You know, he wants businesses to stay at 25% occupancy or 50% occupancy. There's not one thing about that makes sense. I mean, you think about this. You walk into a building and you have a mask on, but as soon as you sit down and eat, you can take your mask off. Unless you live in California and you hear what the governor in California is trying to do right now. I mean, it's unbelievable.
What's the latest?
Well, here's what Dictator Newsom is saying in California, because I don't know what else you could call this guy.
Gavin, yeah.
Is number one, if you're at a restaurant, you have to keep your mask on until you literally are getting ready to take a bite. Pull it down, put it in, and then put your mask back on. And then they're talking about Christmas. They're saying you can't have more than three households, or 3 different families in your household. So like at my family every year, so we have, you know, my family comes over, so my mom and dad, my in-laws come over, usually my sisters, or my sister and brother and their kids come over, my wife's families come over. So who like if we have 5 or 6 different families coming over, which of the 3 are we allowed to have and everybody else gets on the chopping block? Like, it just doesn't, there's no common sense to any of this stuff. And it's just insane what they're saying about if you're going to be, check this out, if it's Christmas and you're going to sing Christmas carols, he acts like a doctor, Dictator Newsom, or Governor Newsom, says that, if you're going to sing, you have to sing below a normal voice. You can't sing like above your normal speaking voice. You can only have parties for up to 2 hours. So God forbid people want to come over and watch a football game, or want to watch a New Year's game on football, because those last way more than 2 hours, right? You have to have everybody out of your house, and they're actually threatening fines for people, or shutting off their power if they do that. But if you look at like Illinois, you got some senators and congressmen and women over there that are saying, listen, if they threaten to fine you, that's not constitutional. They can't fine you. By the way, I don't know if you guys know this, but in the state of Illinois, there hasn't been one fine that's been imposed that they've actually collected. So they're saying, go ahead and open up. If you know, I can't think of his name. It's Representative Bailey down in the Southern District in Illinois. He says if anyone in Illinois opens up their business and you get fined, he'll pay the fine. And he's a state representative there. He knows that that's not going to happen, you know? And the same thing's true in Missouri. I just met this morning with a large group. There were some very well-known businessmen and women that are in St. Louis County, and we've all got together and said, we're done with this. We're opening up. And by the way, if we get together and say that, what are they going to do to stop us? And these are the biggest names that make up about 75% of business in St. Louis County. And so we're just going to open up, and that's just the way it's going to be, whether the dictator likes it or not.
Well, it is the law unless you are the husband of the governor of Michigan, and then you can go out on the lake on your boat when no one else is allowed to.
It's an order, but it's not. Well, it's an order, but it's not a law. And if you look at Illinois, so one of my good friends is he has a house on the same Lake Geneva that the governor of Illinois' family has a house on. He's over there all the time. He's got pictures of him and videos of him driving around with his boat with 5 or 6 people in his boat, no mask on, no whatever, out at restaurants. He's in Wisconsin doing all this stuff, but yet he has to go, when he goes back to Illinois, he has to abide by those rules. And then, I guarantee you, here's my prediction. I predict right now that sometime around Christmas or New Year's, there's going to be video and or pictures of Governor Newsom that probably has a line of cars out at his house at his Christmas party, and there's probably him drinking, doing karaoke at the top of his lungs, going against every ordinance that he put out there just because they're doing these things just to see what people will do. I mean, they really think that they're above us, and I think it's sad. I was just talking to my son about this. I said, you got to remember that government is there to enforce the laws, and that's it, and enforce the rules of the land. That's it. They're not there to do anything else. And my gosh, anybody who's happy with the way things could potentially go one way or the other with, I don't know if you saw the tweet that 50 Cent put out, but 50 Cent, I like how he says it. He goes, you got to be exploit, delete, kidding me. 61% they want to do tax increase in New York to tax folks that make a certain income, 61%. Well, they're going to lose everybody.
I saw the top listed cities and states with the highest tax rates, and they're up over. There's New York, New Jersey, New York City, and they end up over. You're up over 60%, 62%. I guess they've got to be saying that's state combined with federal tax. But that's off the chart. If you want to start talking about now, you're not even getting to keep half of your income. You're less than 40%.
Can we talk about that just for a second? Just a little common sense. And I'm a physician, not an economist, but this is just math. So I was talking to somebody literally Sunday about this very thing. He's a family member of ours from Illinois, and has a certain mindset. And that mindset is, you know what? I think it's great for folks that make over $400,000 a year to get taxed at 61%. And I said, okay, let's talk about that for a minute. So if Walmart, Walgreens, all these places, where do you shop? Tell me the top 5 places you shop, these big box stores you shop. Right. So those people that are now getting taxed at 61%, do you think they're just going to go, okay, this is fine, I'm going to go ahead and just cut it in my profits? No. What's going to happen is now that cheeseburger that you buy from McDonald's that costs $1 is now going to cost $5, and now you have to pay $5 for a burger, and you're paying sales tax on $5 instead of $1.50. That roll of toilet paper that cost $1.25 now it costs $3.25 to buy because you wanted to have 61% income tax for those individuals. It literally is going to affect every single person that does that. So if you want to do that, that's fine. You guys are still going to have to buy from those big box stores. You're still going to do that. They're going to pass the cost down to you. And anybody that thinks that's not the case is just absolutely insane. And I was explaining that to my son as well, and he's like, yeah, that makes sense to me. And he's 15 and he gets it. So it's amazing how hard it is for 50-year-olds to understand.
Well,
that.
And they talk about that they created the show Smarter Than a Fifth Grader. Is that what that was? Because they figured out that the average level of intelligence across the country, there's people a lot smarter, people maybe not quite there, is at 5th grade level. And so that's where you really get into. There's just got to be a lot of people. And then I don't want to get too much into the conspiracy, but it's a matter of just a process. And some people are saying, hey, there's just people out there, Cowboy, they have to be told what to do. That's just the way they are, and there's no way around it. I hate to imagine that, because anybody that can understand our language has enough intelligence for you to communicate to them, here are the issues, and here's what's really going on. Yet I have friends who I won't name, who I get into spouts with on little Facebook battles, or people that I don't even know periodically that I'll chime in and I'll go, that is fake, or that's not accurately portraying what actually happened. And they will fight back like it's their last dollar to defend what they're arguing. It's like you don't understand the overall perspective on this is that they're trying to divide us and keep you from realizing smoke and mirrors. What's going on over here versus what we want you to think is going on or not realize is going on. How much of that is really going on?
Well, you're right. So think about this, and this is something that everybody really needs to just hear this with an open set of ears, an open mind, and an open heart. What I'm about to say. You know, we really get our information from our knowledge, if you will, from three places. Number one, you know, like I have a formal education, right? I went to school for a zillion years, spent $350,000 to become a doctor. I still continually spend money so that I can have continued education. I have foundational learning from schooling, from hardcore schooling to learn certain things. And that's hard to shake somebody when you understand and learn something like we have from a formal education. That's a good foundation to stand on. So I can defend my statements with logic, reason, and education based off of my experiential learning with education. Number two is experiential learning that I just mentioned. So I've had over 120,000 people in the United States that have used 120,000 people that we know of that have used our protocols for flu prevention, cold prevention, sickness. You guys can go to ericnepute.com. That's ERICNEPUTE.com and download that for free right now so you can have it. And so when you've experienced things like you know something happens in life, you learn it. I'm on my third or fourth PhD of life, by the way. It's hard to shake somebody's viewpoint, right? It's hard to shake their understanding because they've experienced it. You can't tell me this can't be done because I've done it multiple times. Well, the problem is the third type of learning, which is the most common type of learning, which is I would say probably 90+% of people get their information this way, is they're just told. You know, I can't tell you how many times I have over 2,500 hours of nutritional education. 2,500. The average doctor has about 5 or 6. I have 2,500. Who would you rather listen to? A pilot that has about 4 or 5 hours of education learning how to fly a plane, or someone who has about 2,500? Obviously, that's a rhetorical question. We know the answer. But I literally have people still say to me the stupidest things like, well, you know, I heard that if you take too much vitamin C, it can cause you to have, you know, a kidney stone or something like that. Well, who told you that? Where'd you hear that? Well, my Uncle Bob told me. What was your Uncle Bob? Is he a nutritionalist? Is he a PhD? Is he a doctor? No, he's a pig farmer. Oh, okay. So you're going to take your nutritional advice and question someone who has over 2,500 hours of nutritional expertise for Uncle Bob the pig farmer? Come on. And that's the thing. And what happens is, and I think to your point that you were trying to make earlier, which is a great point, is you get into social media spats or whatever kind of arguments or discussions with people, and whenever somebody gets their education off of what somebody else tells them, and then you prove them that they're wrong, they don't go, oh, that's interesting, that's cool. They immediately give you the middle finger and give you the F-bomb and say, you're a horrible person, you're killing grandma, you're killing...
They always attack your person.
They attack they attack the person, they attack the messenger because they cannot attack the message. And I've been dealing with that for 15 years because I've been quote-unquote controversial. It's funny how Cowboy telling the truth is controversial. I mean, I was one of the first ones around to talk about how opioids kill people. 60,000 people a year die from opioids. I was the first one to talk about pros and cons of vaccines. Not the first, but pretty loud about pros and cons of vaccines. Talking about, I mean, at some point, I have in my basement, I have on the wall framed articles from Time Magazine and other articles that show doctors smoking cigarettes in their offices, saying the American Medical Association promotes Camel cigarettes because at the time they thought they were healthy. Come on, are you kidding me? So it's just amazing that how science is truly never settled, and the science is definitely not settled on mask. It's not settled on the vaccine, which is another thing that we really should get into and talk about. People need to know where they're at with that because they're not. You guys aren't reading journal articles every day like I am about this. Johnson & Johnson just shut down on Monday of last week. They shut down their phase 3 trial of their vaccine because it was causing such negative side effects with people that they had to shut it down. It was detrimental to their health. Wow, there's all this stuff going on right now, and everybody's hearing these things about vaccine. But then you got Dr. Redfield who says, listen, the mask is going to protect me more than even the vaccine will. And when the CDC then comes out and says, well, the mask isn't really even there to protect me, it's there to protect other people. What are you talking about? That's never been the case for this thing. So it's just so crazy how bipolar the information is. And you know, the news cycles used to be 15-minute news cycles. Now they're 15-second news cycles. It's literally every day. There's been something new every day for the last 7 months that have come out and just blown people's minds. So I think at some point we'll look back and go, wow, 2020, we learned a lot. We realized that the people who got us into these positions don't really know that much that we thought they did, and cause more harm than good to our, to our society, community, and our future.
Well, and that's the freedom of information. Another couple of the topics that we've got here, and I'm going to zoom out on our wall behind us. You can see here a couple of big events. Well, I want to come right back to the freedom of information, the right to free speech, and all of the important things that most people kind of take for granted in our country. But when you're looking at what we've got going on, especially these days, is it a matter of there's just a flood of too much information? There's too much going on out there. Is it controlled too much to where I think it's just a matter of they flood it with so much that they know that they can pound on you enough to where they capture your attention, but you don't have time to really absorb what they're talking about, and then they're off to the next thing. And that's kind of where we got into the discussion in the green room earlier. We talked about on the vice president debate and the president. Well, the presidential debate kind of set the tone for the vice president debate, where they said, and you have 2 minutes uninterrupted. And I thought, what's that? I'm a technical analyst, right? When I used to build the exchange servers for Anheuser-Busch, my title was technical analyst. So that was to analyze, and I would pick apart parts, finding articles on Q articles they found. Why did that blue screen happen, and what was it? What DLL file was corrupted that caused these problems? And my boss finally told me years later, man, you really know how to dig in and figure out the issue. So that's one thing I'm good at, and I figured out that most people, there's not just a blatant, hey, we think it's fair to have this 2 minutes. There's an ulterior motive that some people may say is not the real reason, but somebody else probably thought that through when they said, hey, what if we make it to where, and you have 2 minutes uninterrupted? And the point is that they say, hey, you're not going to allow to counteract and interrupt because they're going to get to say what it is, and that's all people need to hear. And once it's said, right?
It's out there.
It can't be unsaid. And then you get into the squabbling later about the issue that happened before. But again, those people are gone. They're not even there to hear that discussion about why that was wrong later. So, I mean, I just feel as though there's a wealth of information, but it's almost a flood, and the people who are managing it do so in a fashion where they can control what information it gets absorbed, and that's the part of the problem. Yes, we want free information. Last note I'll make on that, and let's talk about it. I love the fact that we have freedom of information, because it does allow me for people that also get to speak their freedom, their message. You can figure out really quickly who doesn't know what the hell they're talking about.
I agree with you.
God, they can say the stuff they're saying, so you know, wow, watch out for those people. Stay away from them. They don't have any clue. Talk about the freedom of information and where we're at, and the censorship, really, where that leads.
Well, I mean, freedom of information, I mean, as far as I'm concerned, I mean, isn't that a constitutional right? I mean, and then you got people that, right? Well, it is, but then you've got folks say, well, Facebook is, it's different. It's a private business. Social media is different. It's a private entity. Is it, though? Because that's where the news comes from now. That's where people get their information. And I think that it's going to be interesting to see what happens. You know, Senator Cruz and the Judiciary Committee are having, I think it's October 28th is when they're starting their hearings with, Facebook and social media and all that to see what's really going on. And I think it'll be interesting to see what happens, because I know that there are some constitutional attorneys, and there are some that I'm working with right now that are going, hey, this is not constitutional. What's happening? They're saying that, oh, you're spreading misinformation. I mean, Facebook fact checkers are a joke, by the way. They literally are a joke. If you really look at them, they don't have an education. They're a third-party outsourced organization. Literally, you could hold a cup of water out there and you could say this water is wet, but the Facebook fact checkers come out and say, no, it's not technically wet. It's oxygen and hydrogen together, and it's not. That literally happens. And
it happened to me.
It happens to all of us. I mean, it happens to anybody that's spreading any information that goes against what their agenda is. And if somebody thinks that there's not an agenda, you're just crazy. And the agenda is pushing a narrative towards one way. And so, like, a great example. Do you really think that over 100 million people we've been able to reach 100 million people sharing our videos, watching, if people weren't interested in that material? Don't you think that it would have just, like, as a free market, it would have went away? You know what I mean?
That's what the free market's all about.
But it's because people, number one, they hear it makes common sense, and then they put it into application, and we're in Missouri, it's the show me state, so it shows people that it works, and then when it works, they're like, okay, cool, I'm going to share this with other people because it's working. I mean, how many people, if we could have continued to share the information that we did when we first set out to do this, about what's really going on in the world today with our health, how many lives could have potentially been saved? So I'm thinking that these are crimes against humanity, Cowboy, not just censorship, but literally crimes against humanity, because the Bible says in Proverbs, it says our people will perish without vision and without knowledge. Well, knowledge is learning something, right? It's learning, like, hey, vitamin D does this, or zinc does this, or you should do this to get healthy. Like, those are things that you learn. Wisdom is taking that knowledge and applying it to your life. And I'll tell you that we're dying right now because of lack of knowledge, really more so of lack of wisdom. And then what's sad is, like, we're trusting our doctors, our quote unquote doctors out there that tell us here's what we should be doing to get us healthy. But just kind of like Dr. Phil says, how's that working out for us? I mean, the medical establishment is the third leading cause of death in the United States. Let me say that again. It's the third leading cause of death in the United States. If you look up Gary Knowles' work, Death by Medicine, he says that some 700,000 people a year die from iatrogenic death, which is death by medicine. But the CDC says it's 350,000 people. 600,000 die from heart disease, 550,000 die from cancers, 350,000 people die from properly prescribed drugs. They die from surgeries that go bad, all this kind of stuff. Literally, that's what's killing folks. So we're getting our information from that group of people, and they're basically saying, hey, wear that mask. It's the best thing that can protect you. You should socially distance. You should wash your hands with antibacterial soap to kill a virus. That's interesting in itself right there. And they're not talking about, what we've said from the beginning. We need to strengthen the host. It's just like Louis Pasteur, the father of the germ theory, said, listen, it's not just about exposure to a pathogen, it's how strong the host is. And that's what I've been about for the last 15 years, teaching people how to recognize where their health is and how to get them to where they want to be. But yet no one in the mainstream is talking about that. Now, Washington University about a month or two ago had an article that says we think that we should really focus on improving the immune system. The problem is, and this is what they said in their article, the problem is that yet there's no drugs out there that can have proven to do that. Well, no kidding. Because listen, if drugs were the answer for everything, like they would have been growing on trees, plants, roots, and herbs. I'm just telling you. I mean, you guys have to understand Pharmaca, the foundation of pharmaceuticals, most every medication comes from some root of a tree, a plant, an herb, or something. Like, people don't realize aspirin comes from white willow bark. Hydroxychloroquine, which you hear about all the time in the news, is a cousin of quinine. Quinine comes from the chinchona bark of a tree. I mean, there's all this stuff that's out there that people just don't understand. And if we don't know certain things, it says, I learned this, Barry Stuckey, God rest his soul, was my 8th grade civics teacher. And he taught me, he said, son, if we don't know our past, we're doomed to repeat it. And that's a problem right now because nobody's talking about the past. Nobody's talking about the options. I mean, think about the hundreds or thousands of years of health wisdom that's been passed down from generation to generation that we just look at and go, oh, that's quackery. People don't realize where that came from. Quackery that term was coined by the American Medical Association. They formed a committee against quackery because the AMA partnered, so the medical doctors and the DOs partnered with Rockefeller and Carnegie when they formed the first pharmaceutical companies to work together. They did this thing called the Flexner Report, and Flexner said, okay, if your schools don't teach this and this, which is pushing drugs, then you're a quack. And so quackery is a marketing campaign, which, by the way, it is illegal because of the Wilkes trial that was the suit that was won in 1978. By the way, 2 doctors out of Missouri started that suit out of Kirksville, Missouri. They won that in 1978, the Wilkes Act. And the Wilkes Act says it is illegal for anybody to call a physician a quack because of that suit that was won. So there's just so many things that people don't know. I'm a history buff. I love it. Because if we don't know our history, how can you move forward if you don't know the past that we've learned from?
There's just so much information to be gained from learning what other people have done in the past. Why would you want to make the same mistakes? And people, that's pretty logical. I like to discuss real quickly the argument with regard to why it is, and just help people understand the basics, because I have a master's degree. A lot of people don't know that, in media communications. And so I had to take media law and media culture and media influence and a number of great classes over at Webster University here in St. Louis, Missouri, after I went to St. Louis U for undergrad. And my undergrad was in communications, so I said that was learning how to BS with people, and now I learned how to BS better. But right. I mean, and from the perspective of just giving people get that information out there to help people understand. I've always had no problem I've never had a problem having a job somewhere because communication is essential to what humans need to survive. But with that, so we talked about, and I just studied this a little bit because this all kind of happened after. I was writing my master's thesis about the internet. I said, this internet thing is going to catch on. I think it's going to make a difference. You think it might change things a little bit? And I talked about how, and this is 1995, and I start off with DVDs. And I said, DVDs have 4.3 times the capacity of a CD. And people are like, well, what's the relevance of that? I'm like, now I'm saying we can take tons of information and compact this stuff and put it in storageable places. And then the internet is going to take it and allow us to share it in a much more efficient manner. Right. And so here it comes Google. At the time, Google launched the same year I graduated with my master's degree in 1998. And then and I had the idea for Google before they did. Now it's get into that discussion. But
Okay.
I had the idea for search. I'm like, this web crawler thing is great, but nobody's monetizing this. They should be putting ads around.
Oh,
this.
man,
Whoa,
you missed it,
I
brother.
missed it if I had come up with that one. But and I used web crawler. I had to ask my grad school professor. I said, how do you cite a website? Before that, you could cite a book, you could cite
Right.
a television short, you had your sources. He said, just put the link in there, and I'll check the link. And I got an A plus. Did a great job. He loved it. But anyway, so now I'm talking about. I analyze this and say the real issue is Google and Facebook and other online mediums like those that are just allowing for social content, for internet content to be shared, are not held liable because they are not technically, according to the original buddy-buddy partnership they got. If you look back, you're going, these guys gave them that great deal to say, if somebody wants to sue you, they can't.
Yeah.
That's what it boils down to. If CBS says something stupid and they can't prove what it is, and you saw where that happened.
Yep.
With I'll never forget the Indian guy was taunting the kid.
Yeah.
He was just standing up on the...
That Selman kid?
Yeah, and they ended up paying him like $255 million.
Yeah.
Dollars.
He's going to get $500,000 by the time it's all done.
$500 million?
Yeah.
That's insane. But they are guilty of distorting the story and
Yep.
ruining his reputation, and that really cost that kid. You know what's it, that might be, maybe the kid would have made $1 trillion. So anyway, they are held accountable. But Google and Facebook, which effectively have turned into the same thing as CBS, as ESPN, as you name it, all the news sources are not held to that rule. And they're saying that needs to be changed. And that's the reason people get away with this stuff now when they couldn't get away with it in the past.
You're right.
Sources. And so is that the problem we have right now?
Well, I mean,
But they can censor you.
oh my gosh. Well, okay, so here's a great example. So I got censored big time because I'm telling you, we were spot on. That first video, one of the first videos that I did during this whole COVID situation was I said, listen, you guys, in order to lower viral load, we know that zinc can do that. We know for a fact. I mean, it's been in the literature for, decades. But you need an iontopher to get in your body, and hydroxychloroquine is an iontopher, so is quinine and quercetin, etc., which is in tonic water. And so I became known as the famous doctor that says you can cure, COVID with tonic water, which I never said that, right? But we were right. We were spot on with it. So then we're back on Facebook. This is about a month ago, and I'm on there, and I have, we have a nutritional product line called Wellness Warrior, and we've got zinc that has ionophores on it, so your body can absorb it. And I said, all right, listen, I got 3,000 bottles. I want to give everybody some zinc. All you got to do is pay shipping and handling. For a couple bucks, they can get it in their hands. So we're literally giving away zinc. I said, zinc, get some zinc, get this zinc. Go to myfreezinc.com. That's myfreezinc.com to get it. And we had 11,000 people on the feed, and as soon as we started giving away that zinc, boom, it went from 11,000 to 1,000 people. And then it went from 1,000 down to 500 people. And that happened by a push of a button or whatever happened because we were giving away that zinc. And I mean, it's just been the level of censorship especially with the doctors that I run with, myself, and at the first rally we did a couple of weeks ago, about a month ago, Rashid Buttar was there, massively censored doctor. Simone Gold was going to come and do the one that we just did last weekend, but she wasn't able to because of censorship. She can't fly right now. She's on a no-fly list.
Wow.
I mean, it's amazing what's happening in the world right now, all in the name of, well, quite honestly, in my opinion, all in the name of public health religion. Because that's what's happening right now. The public health has become the religion. And the priests of the public health are the guys like Fauci and your local health department directors who can't even have a conversation about, the validity of a PCR test. They don't even know what they are. They can't even have a conversation about them. I've tried to have conversations about them. They don't understand that. They don't understand the therapeutics behind it that are out there. They don't understand the alternative methods that are out there. They don't understand the research about zinc, about D3, about vitamin C that's out there that's literally, I can just go here. Look, it's right here. It's on that website. It's on ericnepute.com. It's all right there that helps people. And then there's 120,000 people that lives are better because they're using these protocols, but yet they don't know that. And these are the people that are spreading the dogma that the only thing that's going to stop this is a vaccine, is a mask, is social distancing. And we've never, ever in the history of the world, even when the Spanish flu, when the Spanish flu was around, there was the anti-mask brigade back in the 1918s, and the research clearly shows that people that were taking care of themselves with nutrition and getting chiropractic care and all this stuff actually did better than those that just took a bunch of aspirin or Tylenol or acetaminophen that did nothing. I mean, there's all this research out there, but yet we don't talk about that like we talked before. That's the history that we don't talk about because it could help us elevate where we're at now. And it's just the censorship is unreal. And I'm one of the most censored people on social media right now. There's no question about it around the whole world. That's why I'm like, don't put my name in the title, because as soon as my name gets there, Facebook has these little bots or whatever that scrubs for certain things. If you put coronavirus or cure or whatever in any of the titles, they'll look for that. And Nepute is one of those names that's there.
I can testify that is true because I follow you, and so then I get alerts that say Dr. Nepute is live, and I will click on it, and it'll be, it's off. Before it even got started, sometimes a minute or two.
How crazy is that?
And that's just, that is not what America is about. If you were professing, we should murder all people who do whatever, yeah, that needs to be shut off potentially. There's the argument, some people say, hey, they can say whatever, and you shouldn't censor it all. But you're not saying anything close to that. You're saying,
oh no, I'm saying common sense. Let's have a conversation. I want to pull people into a conversation. I don't want to go you. I want to pull you into a conversation and talk, let you freely think, but they don't want you to think that. If you talk about anything with Donald Trump, conservatism, if you talk about the QAnon, if you talk about any of these things that are out there, you immediately get shut down, and that's just But you can talk about child porn. You can talk about murder. You can see people literally getting murdered on social media, and you can all this stuff, but you cannot talk about, that's not okay. And I don't want my kids to live in a world where that's the way it is, and I don't want to live in a world where that's that. And and I believe it's up to you and me and every one of us to really stand up for the values of what it means to be an American. And if we're going to be tolerant to all the things that we're supposed to be tolerant towards, we should be tolerant towards freedom of speech. We should be tolerant towards being able to do the things that you want to do, and as long as it doesn't infringe on what I want to do, it's no big deal. Whatever happened to those values? I don't understand that.
Well,
but
there is a part on this planet where you can. That is how they operate. It's called China and the Soviet Union, and everybody I know that has either lived in that country or visited that country, those countries say, why do you think people try to sneak out of the country? I'd say you've got a pretty good thing going if your country is the one that people are trying to sneak into, versus the people that are trying to sneak out of all these other countries. And it's a matter of, can they get a clue that here is what humans need to be happy? And if you will give them happiness, I argue that my dad made this point a while back, and he says, Carter, it's very difficult once you've given people free handouts to take them away, right? And I said, Dad, that's a good point. I imagine once you've given somebody free housing, whatever it is, oh no, you're going to take that. Well, if you want to help them really enjoy freedom and the real satisfaction of being alive, they should be able to contribute and act and portray and have a job and help. But I say that the other side of that is, once you've given people freedom, that also is very hard to take away.
Yeah, it is.
And I hope that's where we're at, because we're at a very critical point in our election right here. And it is a matter of if they are really going to continue to push to control as much as they do. And if you really, it's just, why would they be saying these things? It's always the question I ask. Oh, because they're doing what's best. Oh, because they overlooked that. They didn't realize the focus now has become on cases. And we have what's called a case epidemic now, where they're talking. There's another video I watched recently where they talk about, where there's this doctor, he cites all the numbers, he says, here's the curve. Maybe we should have brought that one up. Here's the curve, and it did peak, and it comes down here, and now and they say, oh, it goes back up, and all that went up was the cases. We've treated it well enough with expertise from doctors like you that we can keep that now where people are not dying at the level they were before, because we have the right to investigate and provide for ourselves and figure out the best solution. And I'm fearful that this is going to go away. It will come back. I just hope that we don't have to go through all of it.
I agree with you. Everything in life is a cycle, right? I understand that. And again, we don't need to go through all the cycles of all the stuff we went through in the 1930s, 40s, 50s, and 60s to get to where we were at in the 90s and 2000s, and now here we are today. We're supposed to learn from our past so that we're not doomed to repeat it. Here's some things I always say to people, and just prove me wrong. Prove me wrong with some of this information. Number one, we were told that we were going to quarantine for 14 days. Here we are 7 months later. What the hell happened with that? Hospitals have never been overrun anywhere in the country. We've never ran out of ventilators. You got the Comfort, the ship Comfort and Hope that were in ports in California and ports in New York. At most they had 20 people in their facilities. That was it. You look at medicine has never been so politicized ever. Hydroxychloroquine study just came out 2 weeks ago from Harvard. Dr. Miguel from Harvard says, hey, you know what? Hydroxychloroquine is beneficial. It can help 20% of the people not get high viral load, and there's 0 to no side effects of this stuff. But that was over politicized. You got doctors like myself that have been censored because we're talking about solutions that people can have to their problems, and the average, the whatever. I'm just telling you, whether you want to call it a conspiracy or just the truth, it's a threat. It's a threat to people that are trying to make money off this, whether it's the pharmaceutical pharmaceutical industry or whoever that's pushing an agenda. It's a threat for me to talk about zinc and vitamin D that's cheap, that's free. You go to myfreezinc.com. I'll give you some freaking zinc for free right now. Go ahead. Go do it so people can have it.
They can't block us now.
Yeah.
But my free zinc is just wonderful because I didn't realize, and I didn't even intentionally check this with anybody, but I mentioned to a friend, and she was, oh yeah, Carter, that's actually one of the best nutrients or vitamins that actually helps you to gain the necessary
immune system. So we're talking about
and your reproductive system and your just wellness.
It's amazing, and we talk about T cell mediation for COVID-19 versus antibodies. We know that it's more of a T cell thing than it is antibodies, and if you don't have enough zinc and vitamin D3 in your body, you cannot make T cells. And that's just, I mean, it's common sense. If T cells kill these viruses, but if we don't have enough T cells in our body because we don't have enough zinc, I mean, it's just that simple. And the fact that your doctors don't know this is a problem. I mean, that's a huge problem that they don't know that, and they're definitely not talking about it. And the research clearly backs all this stuff up. And just go get some. I'll give you some zinc. I'm sure there's, we had 10,000 bottles this morning we were giving away, and I'm sure we probably still have a couple thousand left. But it's myfreezinc.com. It's free. You pay shipping and handling. It's an amazing product. But there's just so many things that are out there that's common sense about this that we're just not having a conversation about. And to me, I'm really concerned about that. Really concerned about that.
Well, ultimately, I would make the argument, and this is where, after my analysis, if you will, from the perspective of if you truly want to be happy on this planet, the way that God has at least designed it so far, I can't speak for other planets. All I can do is speak for what I understand on this planet right now, and that is that if you truly want to be happiness, and I learned this, and I'm fortunate to be exposed to this all of my life because my mother was a teacher before I was born.
Right.
I was actually in one of her plays as a baby when she's
right on.
John Goodman's drama teacher. For those who love John Goodman, he may not have made it to the level he's at had my mom not been his.
That's awesome.
And argued that he got the lead when the music director said he shouldn't have gotten the lead, but she was the director, so she made that decision. But you really have an incredible. I said to her again. I said, Mom, I'm still going to make a number of more millions of dollars. I've done fairly well. Right. What I've made over time. Spent a lot of it too.
Sure, I get it. I get it.
But she says, why do you want to make so much money? She says, that's not what makes happiness. And I go, Mom, you're actually, that's where sometimes I wonder why I kind of subconsciously don't get so focused on the money. And tell me if this is true. The money will come if you're doing what is right to help people. And ultimately, even if you don't get the money, I know a lot of that we talked about this, the mortality or the suicide rate for millionaires is double that.
Yeah.
And so ultimately, the point is, if you're doing what there is enlightened with you to help people as a teacher, as a doctor, as a pharmacist, as a dentist, as a lawyer, to help people, that ultimately is what makes you happy. And when you have happiness now, then you can even more help other people. But that's the whole point of it, and you can spread that to others. And there's so many people, it's like they want to take down some other people, and they want to manipulate, and they're going to get massive houses built with money that came from China. I'm not naming any names. But that isn't going to even provide them happiness. Ultimately,
no, man.
The nefarious means that they use to get that money is what's going to bring them down. And you see this happen. Paul Manafort, for example.
Yeah.
And talk about what happened. I finally listened to what it was. He did get busted for a legitimate crime. It was a matter of, and it was a transfer of the money or something from one.
Sure.
And what I forget the specifics, but that was what they got him for. But ultimately, just stay away from those things, and your life is better.
I believe yes. Here's the thing is, and people don't realize this. Like with that zinc, I mean, I give away hundreds of thousands of dollars of that stuff every month. Now, don't get me wrong. I mean, people buy it because they love it, and it's basically a wash. But why am I doing that? I'm doing that because I want to give people the opportunity to know what's possible, right? And I believe, listen, for those of you that haven't figured it out yet, I'm a God-toting, gun-fearing, conservative American. Whether you like it or not, that's your decision. I mean, I don't really care. I love everybody and disrespect everybody the same that they would disrespect me. I mean, we're just Americans. You know what I mean? But the reality is this. I believe we all have a divine purpose, a divine spark, a divine thing that we're supposed to do, a providence, if you will. And to me, it's all about helping people. There's nothing more than I would love right now to be home and not stressed out about what's going on in the world today. And, I feel like I'm in that movie Idiocracy because I feel like we know what's going on, but nobody else is thinking about it. And I'd love to spend more time with my wife and kids and family and all this stuff and not stress out about, what's going on in the world. But I feel like if we don't do something about it, who's going to? And if not now, when? And I want to be able to make a change so that when my kids are around and their kids are around, when they go, hey, great grandpa, Eric, what did you do When that 2020 thing hit, you lived during that. Man, did you make a difference, or did you just live in your basement and eat Hot Pockets and socially distance and wear a mask, or did you tell people the truth? And history is going to show that I did what I had to do.
Well, that's where I believe it's a strong. I know you're the same way. Just tell the truth. Don't hold back. You have to watch carefully how you present things sometimes, because there's people out there looking to take it down, looking to bring you down. But just continue, and my conscience is always clear.
Same here.
Right, and so that just makes life better. So for the people out there, and there's very few percentage, we're only speaking to a very small percentage of people out there, that when you feel like you could take advantage of a situation, you feel like there's something that you could misrepresent or take a little bit over on something, don't do it. All it does, it gets you a little bit of an advantage for a moment, but it comes back on you and costs you much more. And a lot of people just need to hear that sometimes. They see the people that have success, and then they realize later how they got there, and they don't realize that they crashed after that.
Yeah.
And they think, I'll never forget when, say Bill Clinton, I'm like, that guy has done all kinds of interesting, rather nefarious, off the stuff that shouldn't be done by a president. But I'm like, well, if he can do it, and it starts to feed into the community and our culture.
Sure.
And it's just things that shouldn't be done, and that is not a way to live your life. And the reason I even say this right now is because we all know it. It's just sometimes you have to hear it, right?
Yeah.
You have to repeat it. You have to say it to people, and it helps people realize, I'm glad the Cowboy said that, because I know that, but I wanted somebody else to say it.
Yeah, it's true.
And Doctor, I know you're all about that too. A couple more topics here, a couple little quick things to talk about. Let's do a quick review, if we can. I'm going to pull up my. This is the Cardinal Cowboy slide, and it's about the show. And so if you think it's worth being on this show, let me know, right? By now we have, and I got to update this slide. I just did a rebroadcast of this because I moved up to number 3 on the list of local St. Louis personalities, and I just passed up Mike Bush. Jasmine moved up right up with me. We both passed up Mike. But Mike's a great guy. He's been a sports anchor, and now he's the head anchor for Channel 5 local news. But Claire and Miss Allred are the only two above me on this list that we've assembled of the top speakers and local personalities. And I'm kind of a news personality. I'm really more of a philanthropic. Fred Bird's on that list. I passed up Fred. Right. John's a friend of mine. Steve Savar recently sadly got laid off. The industry's changing. I think he's going to land on his feet. I've worked with Ali from Channel 5 at a number of events. They're all on this list. And my point is, use me. I'm here to help get the word out. I want to help people like the doctor here share the method and the message that it is that's positive, that's going to help people. And that makes me feel good. And I don't charge people to come on this show. And I say, come on in here, we'll talk about it. It does allow me to. And I think this is a simple strategy. It's just like, you don't do it for this reason, but when you offer people things to help them, other things come your way.
Of course it is.
It's called good karma, right? You reap what you sow. One of my other guests.
I learned a long time ago, if you help enough people in life get what they want, you'll always have what you want.
You'll always get, if you help enough people, you always get that. Exactly. And I think that was that
Zig Ziglar.
Yeah, Zig Ziglar said that. And it's just so true. So we just want to help emphasize that too. I think we've covered most of the topics I wanted to hit on, but I want to help people understand, really what's at core and what's at stake. The last one to touch on, and we didn't really touch about, and this is the controversial one, and maybe we won't spend too much time. We've already taken too much of your time, but there happened to be a laptop that showed up.
There did.
And it had actually shown up some time ago in a computer repair store. And I'm a computer guy, and I have a favorite. I use JB Technologies. Everybody, if you know JB Technologies, up here in Dorset, in Maryland Heights, Dorset and 270. John Kistler, the owner, good friend of mine. And he can fix any computer out there. And I can only imagine that if he had a computer brought to him like this, as the guy who this was brought to him, he probably would have examined it and said, hey, now I see what's on this. They didn't claim it. It's been 90 days legally. He has to take ownership of it. It's sitting in his store still.
Yeah.
And then he goes, oh my gosh, I should take this to somebody. This could be detrimental information to our country and our safety and our security and our freedom. And he took it to the FBI, who sat on it for 5 months.
Yeah.
Talk about, if you will, what's the implications behind this Hunter Biden?
I saw what
they're finding on it.
One of my close friends sent me, who's a big business guy nationally, sends me a Facebook meme or a meme or whatever you want to call it, and it says, "You had one job," and it was Joe, a picture of President or Vice President Biden and his son. Is you had one job, and that's just not to let your laptop get stolen or lost or whatever, and you screwed it up. But anyway, yeah, it's pretty crazy, Carter, if you think about it. What's interesting is that it hasn't been, Biden hasn't refuted it, Hunter hasn't refuted it.
They've
haven't.
proven it's
They've
his.
proven
They
it's
had the
his.
lawyer come
Yeah.
and say, can I have Hunter's
Yeah.
laptop back?
And so you're right. Yeah. And so that's, here's the thing, man. I it's sad because it seems like in politics, there's no such thing as right or wrong anymore. It's like, in the 80s or even 90s, if something like that were to happen, obviously there were no laptops, but if something was incriminating like that, these people would have never had a chance to be elected.
It was across, and they argued that would have been the case had it happened on this side of the aisle,
Yeah.
on that side of the aisle, and it's just a matter of who controls the narrative again too. And then like we talked about, there's these good cookie cutter deals going. Hey man, if you want to get your new little Facebook thing up there, I'll help you with that. We're going to write a rule for you so you cannot be prosecuted or sued personally. And so now this information can be controlled and it doesn't get out there. Now Biden has gone into hiding, or he's going into where he's going to settle down to be ready for the debate on Thursday.
Oh, okay.
But he doesn't want to be out in public because when they even showed another interview the other day. This gets me so fired up. They're going, he went to some little local fast food restaurant and he got a couple shakes. Did you see this one?
I saw that.
And they go, oh, let's ask some critical questions that might be, because this just broke, that this laptop happened. Here's the critical question. What kind of shake did you order? And he even went to say, it's vanilla and chocolate. Then he says, we call it the black and the white. I'm like, oh, geez. Can we just, anyway. So
I don't even know what to say.
So,
I mean, it's unbelievable. And Carter, you're right. Like, it's just, I don't know. Where's the accountability, right? Where's the accountability? And I think, first of all, here's my prediction. I think that the debate is going to be very interesting on Thursday.
this will come up?
Oh, I think a little bit. And
explain this.
I think it's just going to.
He's sitting there preparing his argument right now. That's why he needs 3 days to set this
I
up.
this
is a Russian thing, they started saying. I mean, give me a break.
And then here's the other thing too. Here's my other prediction. So we got, like you said, we got 2 weeks before, literally 2 weeks from today, for the election. I think this laptop thing is going to be a very small thing compared to what else is going to be happening between now and the next 2 weeks. I truly believe that.
As big as that is, I mean,
yeah.
Because I had somebody put the post up, and these comments start coming in, and they said, "Oh, this is no big deal. This is just another Hillary scandal that they proved is bogus." And I'm like, "Wait a minute. Hillary's emails never got to be read. They accidentally." I used to build Microsoft Exchange servers for a living, right?
Yeah.
That's a high-end. That's Microsoft's premier product for corporate level email communication, which some people think is kind of important these days. And they said, "You want to bring down a company, take down their email system." Well, this guy here was the one responsible. We had to go down one time, and I had to stay up until 4 o'clock the next day rebuilding the server and restoring it from tape, because I was also the guy who was dumb enough to volunteer to say, I'll do restores, but I was building myself into a system where I knew they needed me until InBev came in. That is another discussion, because the tax issue that caused InBev to take over.
Yeah.
But, I mean, it is really difficult to completely permanently delete anything on this planet.
Sure.
And so now they found some of those issues. But this isn't like we have to go figure out where the emails are. They're sitting there. You can see the to, you can see the from, and once you start to analyze, okay, they forged a couple of these. No, there's like 30,000 emails, or maybe, I think, 30,000 is Hillary. There's only 10,000. It's difficult to take the time to forge 10,000 emails that all say from this person to that person. It either happened or it didn't. I mean, that's just insane. And so now, what are we going to do with this information that if anyone else had been touched with this, they'd be like, you're gone, bro. And here we are.
I agree with you. I mean, it's going, I really think that out of those emails, and AG Barr's already kind of touched on it a little bit, so is some other people, there's some very incriminating information in there that runs deeper than just what we're talking about right now. So I really think over the next 2 weeks, I would encourage everybody to get your popcorn, get your zinc and your vitamin D3, get your tonic water, sit down, and let's just watch this show unfold, because I think it's going to be quite interesting to see what happens.
Well, and that's going to be the excitement. So as you were saying that, I felt like, are you talking about some craziness that's going to come out of the other side? And I realize now you're probably talking about Rudy Giuliani released a video, and he said, well, why don't you drop all of what you got? And he said, no, we're going to do this systematically, because as soon as you do that, I think the method there was, again, if we drop it all, they just immediately go and refute it all at once. But if you start to line it up one after another, and you can let the public absorb that and understand it, and then you hit them with another one, and they're going, wait, this is 2 in a row, and they're going to have 10 days straight.
Well, you're right.
Feeding the public with, here are actually proven, tracked, 100% accurate pieces of information that portray something very bad for somebody.
Very bad.
If they were a normal citizen,
And
would have been in jail. A long
And
time.
if you think about it, because the news cycle is so fast now, it used to be 15 minutes, now it's 15 seconds. If they dropped it all today, by Thursday they'd have something else to talk about. Now, remember a while back? I mean, remember NASA predicted that there was going to be an asteroid that's going to hit literally the day of the election. And where's all that stuff? Like, where'd that go? What happened there? I mean, there's just all this stuff.
About what was happening.
Yeah, he said, "I'm out of here." Yeah, I'm not dealing with that deal.
Oh, it's unbelievable. So yeah, we could literally go on for hours. Yeah, great.
Yeah.
Appreciate you coming to see. I do want to touch on a couple of slides that
Sure.
pertain to what you've been working on. There's our slide. Get a hold of me, Cardinal Cowboy. You can reach me easy. Go to cardinalcowboy.com, cardinalcowboy.com/show, and fill out the little form, and I'll review it, and my staff, and we'll look at it. And tonight, John's not here in the studio, but we do have some people to help with that. But here's this other event that you put on a few weeks ago. Maybe it's a couple months by now, but this was a jam-packed, awesome event. And I just want people to see this was the Freedom Tour USA.
Yeah.
And this really helped to portray, and you're talking about, some of the Rashid.
Yeah.
One of the biggest, best
Dr. Batar,
yeah.
Dr. Cordy Lee, Jamie Allman emceed it. Coffey Anderson, who sung at it, that's the guy right over my shoulder right here. He has a new Netflix show that's premiering November the 6th, Country-ish. I mean, there's just some great stuff. And so we did that. We had about 3,500 to 4,000 people at that event. That was September the 12th. And then we did one last Saturday, which was the Red, White, and Back the Blue rally, which what was so cool about the first event, Carter, was, man, I believe this. I believe that people get together to let their light shine so that it unconsciously gives people permission to let their light shine. And so we said, all right, let's go ahead and do round two. And round two is going to be the Red, White, and Back the Blue event, which was at the Family Arena last Saturday, and it was October 17th, like it says up there. And we had thousands of people there. We had a parade in the morning, a patriotic parade that had literally hundreds of cars that were in it. It was a couple miles long. We had Governor Parsons was there speaking. I mean, Senator Bill Eigels. We had all these other folks that were there. We had a great event. Ann Dorn was there. It was about support for freedom, support for Missouri, support for the men and women in law enforcement. It was just a great event, a great day. Obviously, Carter, you guys were there. Cardinal Cowboy was there taking care of all of us. And it was just a great deal. And, we just need more positivity in the world, and that's why we did that. So this is just, the beginning of more things that are going to have to come out of that. People can find out more info if they go to MissouriFreedomTour.com. It's MissouriFreedomTour.com. This is a great picture of Governor Parsons. His grand entrance was he drove this big old tractor up to the stage and spoke.
I could have reached out and touched the tires because he came right in front of where I was stationed, and it was so cool. We put some titles up like, this is what we do. If you have me come out to your event, your site, and talk about that, whatever event you've got. But literally, there and walks out. Here's the governor of the state of Missouri.
Yeah. Pops
out of that window. It's right there. It comes down the steps and walks right in front of us. It goes out. We gave a speech.
Yeah.
To talk about where we're at with all.
It was a great day.
And organized that, got the governor to show up.
Yeah. We
cool.
did a pretty good job with it. And what's cool is the 17th there were literally 30 or 40 other events happening all over the state of Missouri that really birthed out of that Missouri Freedom Tour event that was done September the 12th. So it was just a blessing to be a part of. And again, I'm all about health, and I think health is physical, health is chemical, obviously the right nutrition, myfreezinc.com, all that great stuff. But it's also mental health, right? And having a day where thousands of people can get together and talk about how, common beliefs and, love for the country and support for the men and women in law enforcement. It was just a great positive event, and it was great to see all the kids that were there, and people really loved it and enjoyed it. It was just a great thing to be a part of.
Well, I would say for those people, and I say this just we put ourselves at certain risk in the world just by going out a little bit to say, here's some things I believe in, because there's always the opportunity of somebody that might shoot you down. It might make you feel bad. It might threaten you a little bit. I'm not so concerned with that. I run around with baseball pants.
Yes, you do. Yeah.
And a jersey. Some people think the baseball pants are a little too form-fitting, depending on how old they were and what shape I'm in. But the point is, I'm here to change lives, impact some people, to make a difference, and to help people understand that anything you set your mind to, you can accomplish, even after a coma, like I was fortunate to have overcome. Not fortunate to have gone through, but fortunate to have overcome. And anybody can accomplish whatever, but don't be afraid to stick it out there a little bit and see what you can accomplish by going out and trying something different, because it will change your life. This is the things that doctors and people that have made impact. If you just sat in college and thought about how, your football career didn't go the way you thought maybe it could have gone if you'd been a pro football player.
Right.
And even if you're good enough, like you probably were, maybe I would. the odds of making it are small because
Sure.
of injuries and trades and higher level signings of the first round
Yeah.
draft pick, all that stuff. Don't get stuck on that. Go out and make the difference and make the impact, because it's going to make you happier to feel as though the time you spend on this planet, you've done something to help
right.
people and contribute
a
and,
good
and make
message.
a difference. So that's what the Cardinal Cowboy message is all about. And I started following you a long time ago. I had people talk about you, and I was like, that's Dr. Nepute. He's like, and then I looked over. I'm like, holy crap! I walked right past him. He's sitting 2 seats over from me over here.
Sure.
I don't get completely awestruck, but it was
Stop.
Kind of,
Okay, I appreciate it.
But you've had such an impact, and
Yeah.
you really get what this planet is about, as far as I can tell. I mean, that's just what I think
thank you.
makes a difference, and you're doing an incredible job to help make it happen. So 2 big rallies that you put on, or at least I think you were the somebody came to you with the first one, and you said, I'll do that and I'll make it happen, and you were the one that made it.
We made them happen, both of them.
And that's where you got, and you're talking 12,000 people combined between the 2 events. That's just physically there. That's
Yeah.
like filling up a stadium between the 2 of those.
Yeah.
And
During COVID, by the way.
COVID, right?
Yeah.
And then the millions of people that got to see it throughout the world
Yeah.
for what you put on and the message that you get to.
And we had a great team of people that helped us do it. I couldn't have done this without our committee of people. And some great Missourians came together. Councilman Joe Brazel out in St. Charles County, who's a dear friend of mine, has really been instrumental. Joe and I put this thing on our shoulders and had some great people that helped with it, and it just came together like it's supposed to. So it wasn't just me; it was a group, it was a committee, it was a great group of people. But it was fun to do. And by the way, more to come, because we realized how important it is for the community to gather, how important it is for people to, get together, have common beliefs and understandings of the way that they perceive life, and it's just a blessing to be a part of. So
Well,
good.
like I say, there are a few people who decide, and I'd say I encourage this. My point is, Doctor, is that if you take this opportunity to go help people, it ultimately makes you feel better about
Amen.
life, and that makes you, once you get that feeling, now you want to do more.
Yeah.
And I talk about it as the vicious spiral upward, as opposed to the vicious spiral downward
Yeah.
that many people get too engaged with, and it causes their life to not be so happy. But it can quickly be stopped. Tomorrow is another day, and the people that you're talking that saw you yesterday, that you're going to remember some of the stupid things you did or said, they forget about it pretty quickly, and then they see you coming around making a difference, and they go, wow, this guy's really got it together and making
Right.
a difference. I may
Right.
speak from a little bit of experience there, especially coming out of a coma, and I wasn't, I made decent grades in high school. I wasn't like a scholar. I wasn't that interested in all
Sure.
that stuff. But now I realized that there were people that were a lot smarter than me, per se, that I don't think have had near the impact
Sure.
I've been able to have, only because I went out and did it. And I'm
Yeah.
not bragging. I'm trying to encourage people
Yeah.
to go out and do it themselves, because that's how you really fulfill your happiness on this planet. There is a benefit to it. They're not allowed to talk about it, it
Yeah.
seems like, but that's what comes out of it.
Yeah.
And it ultimately helps the whole world. And if we had more of that, what could we do if everybody contributed 10% of what they were capable of?
Amen. Yeah.
All right, ladies and gentlemen, you've been listening to the Cardinal Cowboy Show. Dr. Eric Nepute, wellnesswarrior.club, I know is one of your sites, and you had myfreezinc.com.
Yeah,
We
yeah.
talked about both of those. Check those things out, because those are great ways for you to get the nutritional nutrients that you need,
Yeah.
so that you can, and it's not just because of COVID. This is across
No.
the board
Yeah.
for any time of the year, any part of your life, because a lot of that's not in our food like it used to be.
That's right.
90% of our population used to be farmers.
Yep.
And so they farmed their own food, brought it right out of the ground, and didn't have to process it and package it and preserve it with chemicals and ship it across the country. So that's where we're at, and it contributes to a lot of the disorders and other illnesses that we're figuring out. We did fix the problem. Now we got to go back and kind of figure that piece out.
That's right.
And not let it become a big issue. All right, ladies and gentlemen, appreciate you guys staying tuned into the Cardinal Cowboy Show. Please like, share, comment, and share again, because we really want to get the word out there. You're listening to the Cardinal Cowboy Show. All right, everybody. We'll talk to you guys real soon, and talk to you about this exciting election coming on. All right, everybody. Giddy up.
This is the Cardinal Cowboy Show.
Giddy up!